All right, so let's talk about breast cancer. As you know, there's about 230,000 women diagnosed with breast cancer, and somewhere between 30 to 40,000. The data on 2015 is about 40,000 women die from this very common cancer among women. And the American Cancer Society just changed the guidelines, certainly for average risk patients with breast cancer. You don't need to get mammogram until age of 45. A lot of women talk about getting it at the age of 40. U.S. Task Force talk about the 50 or so. Where with Dr. Lee, what is your take about some of these changes in the guidelines and why? Because we got so many emails from women that I want to be in charge of my own care, I want to catch it early, and I want my mammogram just like the way it was at 40. What's the pros and cons of that thinking?
Okay. Well, first of all, thank you so much for having me. It's really a pleasure to be here, and it's such a privilege to be able to voice in on this because radiologists really do know it all when it comes to this because we are the imagers, we are both the clinicians as while we're also the imaging diagnosticians. When it comes to screening, I just want to establish some basic facts first. So in America, we're still talking about 1 out of 8 women in their lifetime will develop breast cancer. Remember, this country is heterogeneous, incredibly ethnically diverse, in lots of exciting ways. We're also a complicated population. So we're talking about statistics that are meant to really average out the entire population. I, as an optimist, like to also remind everyone that that still means 7 out of 8 women won't develop breast cancer. But you know what? When we talk about more than 3/4 of cancer diagnoses are in women of average risk, that means nothing other than being female and aging. That is one of the important reasons why we still recommend screening everyone. Now we're also trying to speak specifically about, well, what's judicious screening? What's reasonable screening? The American Cancer Society guidelines, as they reported and as the headlines have picked up, are really oversimplifying their message. It's actually not meant to be as bad or as onerous or as drastic a change as it's being spun to be. And let me clarify what I mean by that. American Cancer Society still very much supports screening annually starting at 40 if you're looking to maximize the number of lives potentially saved. And I'm saying potentially because not every cancer, as you said, is necessarily immediately life-threatening, but that's also complicated.
But that's for high-risk patients.
We're talking about average risk.
That's
they
right.
do still support that, but what's changed now is this idea that's actually ambiguous and uncomfortable. Because in a nation where we're trying to get a little bit further away from paternalistic care and more into shared decision-making, as beautiful a concept as that is, it's actually very uncomfortable in some ways, right?
That's true. But
and so, yeah.
let me ask you something. What does average risk mean? So someone listening to this interview.
Female
yeah.
and aging, meaning me and every other woman out there. Okay, men can get breast cancer at a rate of 1 male per 100 female cases, but we're really talking about women for screening, and average risk by definition means female and just aging. So, and the reason why the guidelines, the way American College of Radiology, Society of Breast Imaging, and actually ACS2, the reason why 40 going annually for as long as you're in good health is still the optimal protocol is because the uptick in risk starts at age 40. And it's also where by going annually, because you're trying to catch as many cancers as possible by the annual time interval, cancers are very heterogeneous. Unlike prostate, you got much more variety normally in women's breast cancers, and you can't tell just by looking at it or by any clinical variable exactly who's going to get a cancer and what kind, how aggressive